This video is going to be about teratogens. Teratogens, this is a general term for any agent. A teratogen is any agent that can harm or interfere with the development of an embryo or fetus. It can include a wide variety of specific agents, and it can include a wide variety of specific effects. So when I teach in-person classes, sometimes I'll open it up and I'll say, so folks, what teratogens have you heard of? And people might name various things. Many people are familiar with the fact that cigarette smoking is not a good idea during pregnancy. We have lots of evidence to show teratogenic effects of cigarette smoking during pregnancy. In terms of other vehicles that are similar to cigarette smoking, vaping, we have less evidence, but no medical professional that I know of is going to say, oh yeah, vaping's fine. With cigarette smoking, we have lots of evidence even showing sort of the method, the vehicle for the harm, and that is the fact that it interferes with blood flow. And cigarette smoking is linked to things like increased risk for miscarriage, preterm delivery, low birth weight. Low birth weight is linked to a variety of aversive outcomes. Also linked to increased risk for sudden infant death syndrome, which I'm going to talk about in the next video if you don't know what that is. And lots of things are linked to cigarette smoking. Now, the tricky thing about teratogens, and cigarette smoking is a good example, is sometimes people will say, well, wait. I know somebody who smoked when they were pregnant. Their baby was fine. Their baby wasn't even small. They didn't even have low birth weight. You're making me think that this stuff that you scientists are trying to tell us is faulty, is misleading in some way. Well, the thing about teratogens is you often don't know exactly what their effect is going to be. Many teratogens are complicated. They are complex in their effects. Some teratogens require a specific threshold. They have a threshold effect, meaning you have to have a particular amount before you see harmful effects. Caffeine is one of those. Like a small amount of caffeine does not seem to be teratogenic, but we have definitely evidence that if you go over the equivalent of 3 regular size cups of regularly brewed coffee in a day, that's when you see teratogenic effects that show up in the research. And most medical professionals will say, cut back on caffeine, try to have as little as possible, but like don't panic if you find out that, you ordered decaf and they gave you regular coffee, but definitely you have that threshold there. Even things that you might think are healthy can be teratogenic in high amounts. Vitamin A. Have you heard of vitamin A? Or beta carotene. Vitamin A, it's good for the body. It has lots of healthful, beneficial effects. But if you go over a certain amount, it can be teratogenic. Now that amount is pretty high though. The evidence we have seen for that typically comes from people who get their vitamin A not from eating like a bunch of carrots, but from like overdoing it with supplements, like taking vitamin pills or eating fortified foods and things like that. So you do want to be careful. Someone who is pregnant, they should be careful with like supplemental vitamin A is another example. About drinking. Should you drink alcohol? When you are pregnant, students will tell me all sorts of different answers about this. Some students are like, no, none, never. Others will be like, oh, I have a friend who says that their mom is a nurse and they said that, women should have a glass of wine a day and they're fine. Or people will say, I heard that in Australia or in France that women drink during pregnancy and they're fine. Okay, folks, I know medical professionals. I know them online, all right? But I have had online interactions with medical professionals from Australia and from France, and they are working very hard to increase public information, public education about the risks of drinking alcohol during pregnancy. Alcohol is tricky and problematic because you will have cases where someone drank through their pregnancy and you don't see drastic effects on their infant. You will have people, though, who have like one episode of binge drinking, and there are evidence for teratogenic effects on their infant. It is very hard to determine who is going to exhibit those effects. So medical professionals in general, they will say, look, shoot for no alcohol, all right? Shoot for no alcohol. Now, sometimes people have been drinking before they knew they were pregnant. You don't have a time machine. You can't go back and fix that. So, I have heard them say, don't beat yourself up for that. But once someone knows that they're pregnant, abstaining from alcohol is generally recommended by medical professionals. Now, one thing we worry about, and this is mentioned in the textbook that I use for teaching this class for introductory psychology, there is a syndrome, fetal alcohol syndrome, which I have seen some, they've started to change up the terminology and the definitions. I'm going to stick with the terminology in the textbook. So fetal alcohol spectrum disorder. FASD, fetal alcohol spectrum disorders, and it's plural in the textbook, so I want to keep it consistent. And so when this happens, when this is detected in an individual, they have physical and cognitive effects. All right, so their features, their physical features look atypical, and they have some cognitive atypicalities. And so this is seen in individuals who were born to someone who did drink during pregnancy. There is no guarantee in terms of how much and who is going to exhibit FASD. But FASD is something that we want to prevent. And so that's one of the many recommendations and many reasons for abstaining from alcohol during pregnancy. Now, some other types of teratogens. There are so many. There are hundreds, if not thousands. And so sometimes I'll ask students to try to name some. Typically, people know that drugs in general are a bad idea during pregnancy. So, no meth, no cocaine, no heroin. I think most people know that. Also marijuana. Marijuana, even though it's getting more and more of a rep, people saying, oh no, I've heard marijuana is not harmful like these other illegal drugs, and I'm in an area where marijuana is illegal. I know there are places in the United States where that is not true, but it's illegal where I live. But in addition to illegal drugs, or some places illegal drugs, is you also have things like over-the-counter medications can be teratogenic too. In general, aspirin and ibuprofen, also known as Advil or Motrin, it's generally recommended that for pain during pregnancy that someone would take Tylenol instead of those. And you always consult with your medical professional in case the research gets updated. And you might be watching this video, and I can't guarantee that things can change after the time of the recording. Medical professional, talk to a medical professional. Anyone who's concerned about these things. Also, there is a medication for acne called Accutane that can cause severe teratogenic effects. And so anyone who goes on Accutane, they usually will talk, if there's someone who's capable of becoming pregnant, they will have a talk with them about, now this is a big deal. You cannot become pregnant while you're on this medication. This can be very harmful. You might have also heard that kitty litter can be a problem. If you haven't seen some of the movies that I have, there's been a storyline in some comedies that were popular when I was younger. Cat litter, kitty litter. The problem, it's not the kitty litter that's the problem, it's what's in the kitty litter from the cat. And so cats, especially cats who go outside, they can get exposed to something called toxoplasmosis, which is like a food poisoning. It can pass through their feces, and when you change the litter box, you can get exposed to that. So they generally say that someone who's pregnant, if you can get a partner or a roommate to change the litter box, get them to do it. If you don't have that option, wear gloves, wash your hands really good. Toxoplasmosis can also be found in like undercooked meats and things like that. Food poisoning. Some food poisoning is no big deal because it doesn't pass through the placenta. If you don't know what the placenta is, it's sort of, think of it as a nice protective filter. And some things can pass through the placenta and some things don't. Some food poisons do pass through the placenta, and so they can be teratogens. One of them is called listeria, and this can come from basically poorly washed or undercooked food. E. coli is a really big, nasty, dangerous one. So some food poisoning is no big deal. The ones who pass through the placenta, they can be a big deal. There are other teratogens. This is just a sampling. Since this is an introductory class, I'll just give you a few. If you take any of my higher level classes on development, I'll give you even more teratogens and go into even more detail about their teratogenic effects.